احنا هنختم البيدياتريك سيشن بالبور نيوتريشن in Middle East why diet fortification is essential. هتقدم الدكتورة بروفيسور فاطمة الحداد.
Good afternoon, everybody. First of all, I would really like to thank Dr. Sanan and the organizing committee for inviting me. It's actually been 2 years that I've been trying to come, but alhamdulillah, this year I was able to make it to your esteemed annual conference. So today my presentation will be about diet fortification of mild and moderate picky eating in children that are typically developed. And my focus today will be about a round panel discussion with members of expert committees. So first of all, I will start off by talking about the picky eating dilemma in the Middle Eastern region, what is its status, and currently what is being done in terms of fortifying and supplementing. And then my focus today will really be more about talking to you about how we were able to develop a systematic approach, guidelines, protocol for trying to manage children who are identified as being picky eaters. It all starts off with parental concerns, and I'm sure many of you out here, pediatricians, will have had a mother come to your clinic and she will have told you, my child is not eating enough, my child doesn't eat enough food, or doesn't have enough of a variety of food. So like I said, it starts off with this parental concern of mother or father or parents or any other caregiver that comes to your clinic, and when you plot the growth chart, you see that the child is growing normally. So as pediatricians, what do? Do you ignore the mother? Or do you try and investigate more? So if you take a look at this slide, this is children between 1 to 12 years of age. And in this slide, it shows that of these children, 40% are the reference standard. So they're growing normally. They're growing at a normal rate, and they are not exhibiting any picky eating behaviors or styles. However, 60% of those children do have at a spectrum, either whether it's mild or moderate or severe, some form of picky eating behavior or characteristic. And of those 60, you find that actually 20% have had faltered growth. So their growth is being affected at this point, which is quite a big number. So let's talk a little bit about picky eating. What is picky eating? There is no universal definition as per now of picky eating. It's pretty much an umbrella terminology that describes characteristics, and it can really be characterized as an unwillingness to eat familiar or unfamiliar foods, and they typically have very strong food preferences. For example, if you put a bowl of rice in front of the child and you put one green pea or a little piece of broccoli, they will not eat it. So this is what we mean by a very strong food preferences. And it could be mild or it could be highly selective. So take a look at this picture right here. So who do you think is the picky eater in this picture? The one to the right or the left? Anybody? The left? Okay. Well, to be honest with you, all of them can be picky eaters, all right? So, and that's really the thing that I wanted you to focus on in this picture. I've personally seen several children referred to us by pediatricians, and they've been obese picky eaters. And when we took their diet history, they were drinking up to maybe 8 to 9 cups of milk a day. We call those children the white eaters, so they'll only take the white foods, the milk, the rice, etc. So again, just because a child comes in and he's obese, do not rule out that he's a picky eater or that he may not be at risk of malnutrition. So to sum up, picky eating is a common behavior, all right? And it can cause a considerable amount of stress to the caregivers, their parents, so please empathize with them a little bit. Listen to them, take that extra minute to really listen to their concerns. Most of the time, you can reassure them that it's benign and it will resolve by itself over time. So, prevalence, in terms of prevalence of children who are picky eaters, well, it really varies from country to country. You have, for example, in the United States, it varies between 13 to 22%, whereas in Australia, it's 34%. Looking more regionally, so we have a lot of studies that came out from Saudi Arabia, so about 2 to 3 studies, and they showed that the range was around 90%, and in Lebanon, it was around 30%, which is quite high compared to other regions of the world. Let's talk a little bit about nutritional risks of these particular children in this population. So one of the first risks that we may encounter is that they may consume a significantly lower amount of protein and energy than other children. And they may also be at higher risk of underweight, although please, like I said in my earlier slide, don't rule out the obese patient as well. Most of them may not meet their daily requirements of essential vitamins and minerals, in particular iron, zinc, and B vitamins. And finally, they also may be at a lower cognitive development. They may be at risk for that, especially in the cases that are severe and chronic. So how do we manage children with picky eaters? So that was the golden question. Are we in need of a protocol and guidelines? Well, having protocols and guidelines may actually help to reduce the delay in treatment, especially when we're able to catch them very early on. And it may also help to give us a clear guidance on how to manage these children in terms of fortifying their diet or giving them an oral nutrition supplement. Now, it was from here that this whole idea was born of, do we need guidelines or not? So it was at this point that a group of highly expert people came together to try and tackle this problem, and we all had the same question in mind. So this was our virtual roundtable discussion, and of course, Dr. Sana was one of our roundtable esteemed panelists, as well as Dr. Khulud and Dr. Wafa were also with us. And so we came together with the background that we all agreed that picky eaters, it was a commonly observed behavior. We didn't have a very clear definition, and its prevalence was quite high in the Middle Eastern region, and we really wanted to come together and try to come up with something systematic that could be used across the region. So it was during COVID times, unfortunately. So we met virtually. We met online in April 2021, and we gathered the opinions of 7 pediatricians across the Middle East and 2 pediatric dietitians, of which I was one of them. And all of them, like I said, had a vast experience in the management of picky eaters. So the whole idea was that we want to clearly define what mild and moderate picky eating was, and we wanted to identify what the role of fortification in these cases should be, and also the possibility of developing a systematic approach to this fortification. Our overall aim was to develop a regional protocol to help healthcare professionals or other allied professionals to identify and manage the mild and moderate picky eating cases. So our target audience were pediatricians, but also other healthcare providers across the region. And the panel defined the discussion aims. So when we sat together, we actually defined what the aims were, we identified all the eligible studies, and we all oversaw the manuscript together. Of course, at the beginning, we collected all the data from appropriate literature databases, PubMed, MBAS, Scopus, etc., and we did critical evaluation of the data that was presented at the roundtable discussion. So what was the result of this? Well, as panelists, we identified that picky eating, they consumed an inadequate amount of variety of food, but because they rejected familiar or unfamiliar food. So the first thing we did was identify and define what picky eating was. That was one of the first things that we did. And we also noticed from the literature that it was the moderate picky eating that had micronutrient, or most likely to have micronutrient deficiencies rather than the mild picky eaters. And it was really important to pay attention to what we called the red flags. So red flags, be it either organic red flags or behavioral red flags like food fixation, anticipatory gagging, etc. And we also noticed from the research that we did was that diet supplementation was very common across the region, but it was sporadic and it wasn't systematic at all. So the roundtable discussion was really a collaborative effort across with these pediatricians and the dietitians to establish something that could be standardized protocol for diet fortification, and we really wanted it to be something that was comprehensive so that we could enhance the well-being of these children. So picky eating, it's really pretty much like a pattern of behavior, and it exhibits selective eating habits. So these selective eating habits, we needed to acknowledge as a panelists that these selective eating habits could be either mild, all right, or it could be at the other extreme where it affected growth and it was severe. And it was very important that we identify these picky eaters and where they were. Were they mild picky eaters, were they moderate, or were they severe? So once we're able to identify, red flags should be excluded. So children who had any of the red flags, be it organic or behavioral, needed to be excluded, and they need to be referred immediately to a professional or specialist in that area. And we really encourage that once you identify them, to use a nutrition screening tool, whether it's Strong Kids or STAMP, in order to rate the severity of their risk. Also, parents and caregivers should be involved, because at the end of the day, they are the ones that are feeding their child, so clear instruction and guidance should be given to the children. So these were some of the themes that came out of our discussions. Picky eating, we know, can lead to micronutrient deficiency, in particular zinc and iron, as I mentioned earlier. And so dietary supplementation is probably one of the global approaches that are being used, but like I said, they're quite sporadic and they're not systematic at all. And despite the region giving a lot of supplements, we still have high rates of micronutrient deficiencies, so adherence is another issue that we are facing. Food fortification is also another approach that's being used. However, it may not necessarily be effective if it's not targeted or individualized at the child's level. So, in terms of the development of this protocol, we found that a food-first approach that has individualized oral nutrition supplement can be effective in managing children with picky eating. And many of the researchers that we read found that ONS, oral nutrition supplements, can help to fill the micronutrient gap. But of course, this still leaves way to look at other means or other food vehicles to enrich their diets. So this is the protocol that we came up with. And I'm not going to go into a lot of detail because soon, inshallah, it will be published. But what I just wanted to tell you is that, again, from the beginning of our discussion, it starts with a parental concern. So the child's mother will come to you in the clinic. She's saying, my child's a picky eater. He's not eating well. You'll take the anthropometric measurements, all right? And you will see that their growth is within normal. You'll take their history and physical examination, and you'll take some lab investigations. If you exclude the red flags that we talked about, then the child should be classified either as being a mild picky eater, so typically in your lab investigations, they should not have any micronutrient deficiencies. And if they do, then they will be considered a moderate picky eater. From there, the algorithm goes. If the child is identified as a mild picky eater, then they should have behavioral support and nutritional intervention, which would be a food-first approach. Enrich their food. After 4 weeks, if you do not see any improvement, add an ONS if needed. On the other hand, if the child is moderately picky eater, he has confirmed by lab investigation deficiencies, then we give behavioral therapy, but we give food-first approach as well as an ONS. We do not wait. And then you follow up and reevaluate. So this was the algorithm that we came up with. These are the red flags, so it could be the organic or the behavioral red flags. And of course, we have to acknowledge the limitation of this study. It does offer a framework for healthcare professionals to work from, but the generalizability is reduced because, of course, things in Bahrain may be different from how things are in Egypt, may be different from how things are in Kuwait, etc. So it's very important that we educate cultural sensitivities, and we also need to recognize that resource is an issue. So resource limits in healthcare access and specialists is also another concern. And remember that you as a pediatrician, your judgment may be different as you as a pediatrician. So again, clinical judgment varies widely within a country and outside of different countries as well. So finally, being the first regional consensus, it's the version 1, right? So we have version 1, and inshallah next year, the years after, we can have update and make changes. To conclude, the panel agreed that food fortification through a food-first approach and oral nutrition supplement would be the best for our region, and we believe that these recommendations would facilitate in identifying and managing picky eating children in the Middle East. And inshallah, very soon we will publish this so you'll be able to have the algorithm to use. Thank you so much.
شكرا جزيلا لحضرتك، ما شاء الله عليكي. احنا كده بنختم الجلسه دي، وان شاء الله نستعد للجلسه الجايه ان شاء الله. شكرا جزيلا دكتوره سناء والبورد كله، ربنا يبارك فيكم.